compassionate alternatives such as palliative care and hospice care are already available. Legalizing euthanasia introduces serious ethical, legal, and social risks, especially for the most vulnerable individuals.
The affirmative team, you will now address and challenge the arguments presented by the negative team. Your time starts now.
Okay everyone, as you said, it violates the necessity of life. As we all know that modern healthcare already allows referral of life support and refusal of treatment. If preserving life at all costs were absolute, then those would not be able to Patients can choose medical treatments. They should also be allowed to choose to end unbearable sufferings when no treatment can cure them. Second, euthanasia is an act of compassion. Some illnesses can cause extreme pain that even modern medicine cannot fully revive. Forcing patients to continue sufferings against their will is inhumane. Legal euthanasia offers a merciful option when pain management fails. But keeping someone alive just because they're afraid to let them go is not respect, it's cruelty. Not every pain can be managed, but diseases destroy quality of life completely. In those moments, allowing someone to choose peace is the kindest path. Euthanasia isn't about devaluing life, it's about following the person's wishes.
Not the sufferer, which is the person, but the suffering. The role of healthcare is to stand beside the patient until natural death, never to become what? The cause of death, and that is prohibited. Ethical foundation supports euthanasia, meaning ethical principle of autonomy, non-maleficence, beneficence, justice, and fidelity, most important. Non-maleficence, do not want intentionally kill. Beneficence, provide comfort and what? Not death. Justice, protect vulnerable populations, which is the dignity in death and dying. And fidelity, maintain trust in what? Healthcare. And it also arises situations like this, which would be, what if the patient expresses, will my doctor try to save me or suggest ending my life? That erosion of trust, especially in healthcare, especially for us, future nurses and healthcare provider, that erosion of trust is a major concern. Ending life, another one, ending life removes the possibility of, firstly, recovery, second, remission, and third, what? Medical advancement. Ending life removes that possibility. You eliminate the sufferer, not the suffering. That is the main point. And while you prioritize the autonomy of the patient or respecting the patient's informed consent, autonomy means patients have the right to make informed decisions. It focuses on relieving the pain, which will be palliative care, and improving the quality of life. It doesn't mean a terminal illness, it doesn't mean an unbearable suffering. Termination, dapat na nato i-consider na i-terminate na nato ang kinabuhi. Once again, anti-euthanasia. It has intrinsic value. Life has intrinsic value. Us as human, especially as just human and just providing health, it is not our scope. It is not our focus. It is not where we should immediately consider that in ana na dayon na dili na ta o consider na pwede pa na abay ikabuga na bay life ang patient because there is dignity. Naghaboy na ng dignity in life, and it's not. So however,
Yes, I can answer the what question am I?
So, I have a question with you in regards to your argument, because I have stated earlier during my time speaking that I gave evidence of a actual case which euthanasia because as he stated, a 29-year-old woman from Netherlands who verbalized every breath she takes is suffering or something along those lines. What I'm gonna ask from you is, you have a point, but I have yet to hear evidence of your case actually being used and effective. So I'm gonna ask you if you can give evidence of such situation of euthanasia actually being a negative effect to someone for the sake of the argument.
Euthanasia, there is a Pilipinas. It is only legalized pa in European countries, which would be Canada, the Netherlands, and such. But currently here in the Philippines, you are asking no if there is a true to life scenario nga na buhat yun ang anti-euthanasia, correct? Nga dili yun, true to life case scenario nga dili na ato use ang anti-euthanasia nga dili ka mo patay euthanasia kabay true to life scenario ana. But that is okay because here in the Philippines ang atong ginabate pa is legalizing pa pro-euthanasia. So we cannot kanang kuan diri sa in a real life setting diri sa ato as Pilipinas nga naanay kanang kuan nga ang pro-euthanasia ang anti-euthanasia is kuan. So I will repeat nga diri sa Pilipinas is hindi pa legalize ang pro-euthanasia. So especially the ang kuan na niya is since hindi pa legalize ang pro-euthanasia, which means anti-euthanasia is being practiced. So dili ka kuan kung sa specific case scenario nga nabuhat ang anti-euthanasia, dili pa lang siya legalize, pero may ginabuhat ang anti-euthanasia diri sa Pilipinas. Because diri sa nursing ethics natin diri sa Pilipinas is ang job sa atong healthcare, our nurses is patient preservation. Dili pa practice ang pro-euthanasia diri. So, as the counterpart, especially, nag-dili pa practice on anti-euthanasia sa patients because it is not legalized here. So, that multiple case life scenarios because we do not practice pro-euthanasia here. So, we are always practicing anti-euthanasia. And you want to legalize, no. But that is the point. Autonomy, dignity of the patient, not automatically just because of terminal illness and very suffering. Labi na nagkuhan na ng patient sa kuhan, nara ko yung dignity, death and dying, nara ko yung intrinsic value. And
Is voluntary killing, as you stated about the patient being unable to, let's say, provide their own vocalization of their own consent. As such, the parents or those closest will be the ones with the consent of the consent. Now, remember, the reason why we're trying to legalize is that because other countries have, and they have their own reasons and their own backgrounds and their own legal way around in terms of cases such as that. We don't necessarily have to implement it immediately. We could add it slowly, and through those starting for the first few years, it is through there that we could improve and change. Because remember, we are Philippines, and yes, while it's true that we must follow culture, we must change. Times are changing, and things are gonna get only worse and worse. It is times like this where voluntary killing or voluntary euthanasia will have its own benefit to our country. Yes, we don't have it as a country yet because it's still new. It is something we do not have or something we are not yet used to as of the moment. It is because we need to introduce it and we must be used to it. It is through experiencing it that we can finally find ways on making it part of our culture. Because as you stated on 25%, that we, the nurses, will be the ones killing. You've also stated in your earlier argument that we are the ones who only provided the equipment. The ones who consented to the thing is not us, but the patient himself. We are only the ones who provide the means and the methods to do so for them who are the ones in complete consent, and it is their own words of whether that they will or want to. We are just the ones who are doing it for them because they are too either too scared or unable able to do so. We are just helping them alleviate their pain, their suffering for them and those closest to them. Now, it is, as you said, about for the whole personal matter in regards to being asking the patient, it's also a more deeper value, in which case, imagine you the situation of you, the nurse, sitting beside your client, and the client tells you, please, much. By that point, what can you do? Can you just tell the client it's fine, it's alright, just continue on? Those are words the client does not want to hear. They want either confirmation or words from those close to them. But by that point on, can you really, as a nurse, we cannot, it is part of our duty that we cannot force the client, we cannot tell the client on making their own decisions. All we do is give them the info and it's up to them to make their decisions. All we do is act out on the decision they make.
As medical professionals, we can, from your question, how to assess, we can assess and manage pain through specialized neonatal care and comfort measures. So, the ethical duty of caregivers is to protect life and provide compassionate treatment, especially to vulnerable patients like newborns. So, ending the newborn's life removes any possibility of recovery or comfort and violates the principle of protecting the most vulnerable. True compassion comes from care, support, and should be euthanasia ever be permitted, or if government shall, who should decide?
Now, good question, judges. Now, as we have stated, other countries. So, as you have stated, other countries have also practiced euthanasia, and as such, they have their own formal way around in terms of situations like that. Now, for people with severe mental disorders such as that, there are limits on whether or not it should be euthanized, not okay to euthanize, or those that shouldn't be euthanized. For example, let's say someone with just mild mental disability. Those are grounds in which euthanasia should not be permitted. Patients an opportunity to end their suffering early while also alleviating the burdens of those closest to them from supporting them. Now, there are many cases, there are reasons for